Hi, this is Dr. Tom Coates. I'm a professor of medicine in the School of Medicine at UCLA and also the director of the UC Global Health Institute. Thank you for tuning in. Obviously, COVID-19 has changed all of our lives in some interesting and perhaps some difficult ways. I want to invite you to join us on May 2nd at 9 a.m. when we'll be hosting a UC Global Health virtual conference for 2 hours. And we're going to be inviting speakers from different perspectives, maybe different perspectives from what you've heard. One speaker will speak about the planetary implications, the One Health implications of COVID-19. This is not the first, nor is it the last pandemic that has been caused by animal to human transmission of a virus. My grandmother died from the 1918 epidemic. All of us have grown up with the HIV epidemic. We've had SARS and we've had MERS, and now we have COVID. This won't be the last of many epidemics. So we want to talk about how these things come up and what we can do to protect ourselves against them. We also want to talk about how COVID is affecting various segments of our population. You know, we hear the broad scale of things, but there are a lot of people who are low on resources. There are a lot of countries that are low on resources. And so we're going to talk about COVID from the perspective of women's health and empowerment, and how women are being called upon to deal with this, and how it's affecting sort of core services like family planning. Then we want to hear from our colleagues in low and middle income countries. We're going to hear from a colleague in Kenya, a colleague in Peru, and a colleague from Asia about how their countries and people are responding. You know, it's interesting. I mentioned the HIV epidemic, and this epidemic has a lot of parallels to the HIV epidemic, but there are a lot of different parallels as well. This is very easily transmitted, very rapidly transmitted, not nearly as lethal as HIV, but much more easily transmitted to great parts of the population. And it's evoking similar responses, in some ways stigmatizing responses. And that is very important from a social perspective too. We don't want to lose sight of that. I think we're all proud of the contributions, the collective efforts of the University of California. Certainly, my appointment is in the Division of Infectious Diseases. I'm not a physician, but I know that my colleagues are working overtime to take care of the more than now 20 patients in the UCLA hospitals. And this is true of all of our health centers across the entire system. We also know that those of you who have teaching responsibility, you're being challenged to figure out how you can use remote teaching in a way that is creative and satisfying when you're used to in-person teaching. And it stretches our imagination that the current pandemic may be very informative for our students. I want to emphasize that the University of California is using its creative talents to address the needs of the epidemic, working on taking the lead in clinical trials of new therapeutics, working to develop novel rapid tests, which has been done at all of the medical centers. The engineers are working overtime to figure out how to make them rapid and informative and sensitive and specific. All of our institutions are working closely with the California and county public health systems and working on many other dimensions as well, coping with the epidemic, the isolation for people who don't have an opportunity to get out and interact with other people, the economic impact, how it's affecting people who don't have job security. So these will be the issues we discuss on UC Global Health Day. The theme will be COVID-19, Planetary and Human Dimensions. May 2nd, 9 to 11 a.m. Please stay tuned for more details on the speakers and how to sign in. It will be free. And remember, take care of yourselves. Maintain physical distance. I don't like the term social distance. Maintain physical distance, but social solidarity. Thank you.